Hey guys, my name's Dan, and today I want to talk about dental residency, specifically my experience with GPR. I'll be briefly going over what it is, what I learned this year, and if it's right for you coming straight out of dental school. So let's get into it. So, what is a GPR? A GPR is an optional 1-year paid residency for general dentists looking to improve their clinical abilities and their didactic knowledge of all things dentistry. These dentists may be interested in specializing. Some GPR residents use this year to improve themselves clinically while they figure out if they want to specialize or not. Others do a GPR year to better ready themselves for the real world because maybe they didn't feel ready after dental school. Especially after COVID, many of us dental students didn't feel like we received the proper dental education to go out in the real world and practice on real life patients. That's why many dental students sought a GPR year to better themselves as a clinician. For me, I chose to do a GPR for both of these reasons. I wanted to become a better clinician overall, but also I wanted to figure out, or rather, I wanted to decide clearly on which specialty I wanted to pursue. I knew I wanted to specialize, it's just that I didn't know exactly which specialty I wanted to go into. During my 1-year year, I was able to decide that I wanted to go into endodontics. So what did I learn during my GPR year? It's been a great year, and I truly learned so much. It's gonna sound cliche, but I really don't recognize myself from what I was clinically at the start of the year versus where I am now. If past me could see me now, he'd be impressed, he'd be proud. I can do now and do confidently many procedures that I had no idea how to do coming out of dental school. What it came down to is I had rotations, and these rotations consisted of a 6-month general dentistry rotation, a 3-month oral surgery rotation, and smaller rotations in emergency medicine, anesthesia, and oral oncology. One of the great things about my training this year was that I really felt like I was able to cater my training to fit my interests. A lot of this was because I was 1 out of 2 residents at my VA program. Generally, these programs will select very few number of residents per year. And what that means for you is that there's going to be a lot of individualized attention for you, and that means that there's going to be no shortage of patients. And usually the program directors will be able to kind of structure your training to fit your needs better. You know, they don't have to formulate this cookie cutter education program to fit the needs of 10 different residents. They can formulate the program to fit your needs better. For instance, my program director knew that I was interested in endodontics, and so he provided me many patients who needed root canal treatment. Because of this, I was able to perform over 50 root canal procedures in the span of not only that, but especially in my program, I had the mentorship of an endodontist who's been practicing for over 30, 40 years. He taught me so much about root canals, about the fundamentals of root canals, which I had very little experience of in dental school. I also learned a lot about managing patients who have a lot of comorbidities, especially at the VA. A lot of the veterans have many medical conditions such as high blood pressure, diabetes, heart conditions, and they're on a lot of medications because of this. Knowing how to adapt your treatment planning based on all the different medical conditions, these are all valuable skills that I learned during this year. Especially in my oral surgery and oral oncology rotations, I got to see how dental specialists interact with other medical specialties to treat these medically complex patients. I'm right now doing my oral oncology rotation. Every day I see how patients with cancer and patients who've undergone radiation treatment have to be aware of different things when it comes to their oral health. For instance, patients who had radiation treatment in the head and neck area, they have to be warned that in the future not to get any teeth extracted because of the potential for osteoradionecrosis, aka bone death. And patients who are on bisphosphonates as well, they have to be warned about the risk of bronch, which is bisphosphonate related osteoradionecrosis. As a GPR resident this year, I was able to learn and see so much about how dental and medicine combines and how that can change treatment plans for these highly medically complex patients. So would I recommend a GPR? What do you think, Dior? Would you recommend a GPR? If you're in a situation similar to me, where you're not sure if you want to specialize and maybe you feel like your dental education didn't prepare you well enough for the real world, then yes, I think a GPR would be great. It's great because you're given the autonomy, but you're also able to ask questions and learn from the guidance of experienced practitioners. However, it's still a year where you're not making as much money if you had worked in private practice. I would say that if you're more considering going into general dentistry, then I would keep the option open to just go straight into private practice. I think mentorship is key. If you can find a good mentor, someone who can help you when you get stuck in a procedure, I think you can really do well, even in the private practice world. But finding good mentorship can be quite difficult. That's something that's great about GPR, is that there's always someone there who can help you out if you're stuck in a sticky situation. I feel like with the mentors that I had this year, I really had the fundamentals drilled into me, and I was really lucky with this program that I chose. I know that not all GPRs are made the same, but if I had to do it all over again, I would. And I think a lot of that is because I chose a VA program, because VA programs inherently they choose a fewer number of residents per year, and so they focus more on each resident and give you more individualized attention. And so the answer is yes, I would 100% recommend doing a GPR, especially a VA GPR. So a little bit about my plans for the future. I have less than 2 weeks left in my GPR. I can't believe how fast the time has gone by, really. The timeline of these residencies is that literally you start at the beginning of July 1st, and then you go on all the way until July 1st of the following year. So currently I'm applying for endodontics programs, like I mentioned, and I'm waiting to hear back from interviews. I have one so far from my top choice, the New York VA program, and I'm super excited. We'll see how this cycle turns out. I'm really hoping that I can get in this cycle, and I don't have to apply again next cycle, but we'll see. Endodontics is a really competitive specialty and field. It's only a 2-year specialty, and generally it's not paid. The residents are not paid, but there are paid programs, are even more competitive than the other ones. And so that's my plan this year. In July, once my residency ends here in Houston, I'm going to be going to Indiana, where I found a position with Aspen. And so I found it through a friend of mine, and so I'll be working there for another year. And if I get into endodontics this cycle, then I would start my program July of 2025. Thanks for watching, and if you want to see more informational videos like this, let me know, and I'll catch you on the next one.